Okay, welcome Martin and John. Now I know we've discussed in the last, I think it was about 4 or 5 months ago now, when we last discussed the situation with COVID-19 and PH services and things. So we felt it was good to get together. We're doing a new thing here with the Zoom meeting. So not only do people have audio, but they got visual. That might encourage them to listen, or it might actually, John, encourage them to turn off as well, because your office is a little bit of a mess in the background, but we'll allow that to be the case. So just as a way of introduction, because many people will know you if they come to your centres, but could you, Martin, introduce yourself first, just say who you are and your sort of position in the world of PH, and then over to John, and then we'll go into some sort of discussion areas.
Yes, thanks, Ian. Hi, my name's Martin Johnson. I'm the Director of the Scottish Pulmonary Vascular Unit based at the Golden Jubilee Hospital in Glasgow.
Okay, and John?
And I'm John Wort. I'm clinical lead for pulmonary hypertension at the service at the Royal Brompton Hospital in London.
Yeah, right. So let's sort of visit. As I say, 5 months. A lot's happened in 5 months in Europe and in the country, and it's been a challenging time for all of us. And when I'm asking these questions, I'm being really honest to people that are listening and watching this, is that we're not expecting absolute answers, because things change, and in a week's time the advice might change a bit. So we're looking for general sort of comments here, and honest comments. So not, if we want to, it's not going to be all reassuring all the time in that sort of sense. Everything's going to be okay. So it's honesty, it's integrity, and what that's why we've asked you to onto this. So, John, we'll go to John first on this one. The current risk to people who have got pulmonary hypertension with COVID-19. What would your general, if you were in clinic now speaking to somebody who said, "What's my risk, doctor?"
Well, I think I would say it's the same as if they'd asked me a few months ago. I think as long as people are accepting and using the government advice, the risk is very low for people with pulmonary hypertension. As long as people use a sensible approach, using social distancing, washing their hands, using a face mask where it's advised, I think the risk is very low. Yes, and I would advise, therefore, that the shielding is now finished. Currently, there's no shielding, and therefore I would advise people to get out and about, because of the benefits of that, within the government guidance. So that's what I would normally say to someone in clinic.
Do you think, John, I'll come to you in a minute, Martin, just ask you very more of that question. Do you think, John, because that all seems very simple guidance. The guidance is simple, but it's simple because it is simple, isn't it? We don't have to do massively different things.
No, it is. I mean, I think I quite like their wash, face and space sort of mantra. It is simple. I think simple things like going out when it's not so busy, avoiding crowded situations, washing your hands, for the 20 seconds and more than you would normally do, wearing a mask if you are able to wear a mask, because I do understand that people with medical conditions can find wearing masks difficult. So that's another thing we can discuss. But I think they are relatively simple things, and it is important to get out, because I see every week when I talk to people in the clinics how it's affecting them being locked in, how they're not doing so much exercise, how they're feeling stressed, and that is alleviated to a certain extent when people can get out and see the sunshine and see some of their friends. So.
Martin, can I ask you to address this question of that John sort of talked about here, that are people, when we talk about risk, are people with PH more at risk of catching COVID, or is it more at risk of, if they caught COVID, what is it, more risky more susceptible to catching COVID, Martin?
No, I don't think people with pulmonary hypertension are more at risk of catching COVID, and probably from the way that people with pulmonary hypertension behave, they're much more conscious of their health. They're probably less at risk than the average population catching the disease because they are more careful. If they did catch the disease, then that would be when you might talk about this group having an increased risk. But it's probably not, having pulmonary hypertension is probably nowhere near a stronger risk as other things, as being very elderly is an extreme risk with this condition. Having pulmonary hypertension means you don't have as much reserve, but most people who catch this disease still get a mild viral illness and don't necessarily come to any harm.
John mentioned, Martin, about the use of face masks, which is in our case can be more challenging because of, not for everybody, and it isn't the case for everybody, but when you've got a condition that makes you more breathless, wearing a face mask can be more difficult. What's the benefit of the face mask, Martin? Because is it to protect you or is it to protect other people?
That is a question which people debate. Yeah. It really works both ways, so it's protecting you from catching the disease from other people. Particularly protecting, some people would say that the act of touching the face, the face mask reminds you that you're doing that, and you should avoid doing that. Protecting other people. Yes, I think that it does have a role in preventing spread of disease, particularly in areas where people can't socially isolate. I think, however, it is one part, and not necessarily the biggest part in the process of protecting yourself and others from the condition. And I think it's equally, if not much more important to do the other things, like wash your hands, avoid the crowded spaces, and just simply not put yourself in areas where you'd be at risk.
Okay, John, you mentioned about getting out and about that bit more than people were, and the potential benefits of that. I mean, it's obvious again, and what are the benefits or the risks of not getting out and about? Would you sort of get in conversation with people with PH and the families?
Well, I mean, I think there are several aspects to this. Certainly, there's the sort of the effect that being locked in, so to speak, has on your mental health, and I think there's a lot of evidence that there is more mental illness associated with during this period because people feel so isolated, and clearly getting out. And I can remember personally, it was just those Thursdays where you go out and clap for carers and workers and things, but just seeing your neighbour and shouting over the road to, that relief or almost joy of you might not normally have with your neighbours, but anyway you did this time. So I think there's a mental aspect, and I think also there's a physical aspect as well, because we know increasingly that exercise is good for people with chronic conditions, certainly very good for people with pulmonary hypertension. And I know from talking to people in the clinics that they say themselves they've got out of condition, they're not exercising so much, and that can't be good for them. And so getting out, going for a walk in the park when it's a quiet time, is good for both mental health and physical health, and therefore good for them overall. Yeah.
Martin, could you actually say, because one of the questions that has been coming increasingly sort of prominent into the PH office, and I know on Facebook about the PH Facebook thing, is about socialising. So these things like, because obviously it's possible to go out to a restaurant or to the pub, etc. Are they, and again, we're not, there's not absolutes in this. What sort of general advice would you say about that, Martin, about, socialising in a wider context, even with the washing the hands and the space in the face?
Well, it is, socialising is clearly very important for your mental health, to keep in contact with other human beings, with relatives. You do have to balance that with a view on that does come with the more you socialize, there is more risk of being exposed to people with the who might be carrying the virus. I mean, just thinking about the numbers in Scotland in the moment, there've been I guess 1,500 people diagnosed with coronavirus in Scotland in the last week. So that is 1 in 3,000 of the population. So it's a sobering statistic to bear in mind. So certainly, yes, socializing is good for your mental health, and but I would definitely follow the rules that are there in place to minimize your risks from that. So that these various rules of 6, which have been implemented differently amongst the different countries, and then if you happen to be in an area which has a particularly high prevalence of the condition, that the local I guess mini lockdown measures that have been imposed. For example, in Glasgow currently, you don't there's no socializing between different family groups indoors. So I think yes, but remember the virus is still there, and you don't want to put yourselves at unnecessary risk.
Yeah, that's really helpful. It's sort of practical, and as you said, you demonstrate in what you say there, Martin, about the different geographical challenges, because there's not one cat fits all, and different. Mm-hmm. Where you've got populations more concentrated, you may get that and you get an outbreak. John, can I just ask, because again, it's interesting listening to how people talk, because Martin mentioned about this increased rate of infection and things. And I know this is a debate thing, but it'd be interesting to hear what your thoughts are. Are we seeing more incidents of infection and positive tests because we're doing more testing? Is it as simple as that?
No, I don't think it is as simple as that. I think it is a combination of things. I think it is partly due to more testing, but certainly I think there are more people with it, and it seems to be in the younger groups as well, because they're going off on holiday to Greek islands and Croatia, and also with going back to school. And I think there will be inevitably an increased incidence, as well as there being more testing as well. So I think it's both.
I think it's both. Yeah. You mentioned there, because it just reminded me about the issue with school, going back to school, and obviously not everybody with PH will have children, but they may have grandchildren, etc. I'll ask you both on this one, what your thoughts about not children going back to school because the law says they have to, so that there's that. Any sort of extra precautions, visiting grandparents and things like that, because that does create a huge angst.
Yeah, well, I mean, I think again, a lot of this is common sense. We've mentioned about the minimizing physical contact. Ideally, for instance, if going to see grandparents, for instance, maybe if you can meet outside, go in the garden or somewhere, at least where in a well-ventilated room, things like, it's just common sense, don't get too close. I know it's not very nice to say that, and the grandparents, you just want to give them a big hug and so on. But at the moment, we do have to balance things and live slightly differently. It doesn't mean you can't see them though and talk to them. But so I think that just washing your hands again more often than you would normally. Yeah.
Yeah. Martin, can I just ask you, I'll expand on that one a little bit as well. I mean, one, if you want to say something about the school and children specifically, yeah, adults, but the other bit, which sometimes is to do with this, about travelling on public transport or not to. And I know the two can, because children do travel on public transport, but we all do. So if you want to answer the thing about the school first, but if you could sort of say something about safe to travel on public transport.
Well, the school side of things, I think the government does have it right here in selecting in areas of increased instance of the disease to really suggest measures which increase distances between people. And so, for example, the idea that if you're in a high prevalence area, you don't have people into your home, although you can socialize outside, enables you both to have that contact with people and yet protect yourself. So I think that kind of advice is very sensible, and certainly staying abreast of what's recommended in your area is a good idea. And the government websites, the news bulletins, are usually very good at clarifying that for you. Public transport, again, that's a very interesting area, and I think it really depends upon the kind of region that you're in. And if you're in a high prevalence area, it is very difficult to socially isolate on public transport, and you might want to, from your own perspective, avoid using it as much as possible. However, if you're in a low prevalence area, then I think that your chances of coming to any risk from that are relatively small. So I think it depends upon the area you're living in.
John, it'd just be interesting for him, because you're London sort of centric. I know you cycle and things. What London's very noted for heavy public transport use. Any concerns there, do you think?
Well, I think yes. I mean, I think you are more likely to come in contact with people in densely populated areas such as the tube, and so I would advise, wherever possible, to try and avoid public transport in that kind of environment. So, and again, I think that's going to what Martin was saying. It depends really on the area, doesn't it, and circumstances. So
I think Martin made a really important point there as well, John, didn't he, about being aware of your locality. So there's a national picture, which we can all do, you know, BBC News, ITV News at 6 or 10, but be very much aware of your national, your more local sort of area, because that's the bit that really matters.
Yeah, certainly. If you're in the Highlands of Scotland or in Devon, it seems to be that's a good place to live at the moment, and use the public transport to your as much as you want in those areas, if it exists.
Just to move on to something slightly different now, but along this lines, that obviously this has been going on for 5-6 months, and probably will go on, for being realistic. You know, we're not being whatever normal will look like in the future, but you know, I'm thinking about the next 6 months, and that's not being pessimistic. You know, till we're somewhere a bit more secure, I think. But people becoming unwell, so people with pulmonary hypertension feeling unwell, this lack or encouraging people to interact with healthcare itself, you know, when you and our population, the PH population, you know, the importance of, if you're not well, putting your hand up.
Is that to
well, go on, John, you're first.
Well, no, I think that's vitally important. I think we should say that, you know, we even during the first wave, we were never actually closed per se, and I think that we always could just see people in emergencies, and I think we're in a better position now, obviously. But even if there was a significant second wave, the hospitals are prepared in a much better way with safe pathways to see people. So it really is important that if you are unwell and you think your condition has got worse, or you're concerned, that you seek help. It really is important.
I mean, Martin, I know John sort of mentioned there, I think probably quite rightly focusing on the aspects of PH, but just general health and well-being, and you know, we hear things like you know, chest pain. So this is because lots of people listen to these infocasts, people with PH, and not the willingness, or the, you know, picking up the phone to the GP, trying to see a GP, dental care and things like that. Very important, Martin, do you think?
Yes, the consequences of not seeking help when you need it could be worse than the risk of being exposed to this condition. The one thing I would say is, or in addition to what John said, is that hospitals are now, we had a first wave of this condition. We have a better understanding of it. a better understanding of how to work alongside it, protect people from it. So I find it encouraging when I hear the politicians now say that if a second wave happens, we're not going to close things down as we closed things down before. We're not going to close down as much of the standard NHS activity as we did. And I think that's correct, because certainly locally we would feel very confident in both dealing with this condition and carrying on with the normal daytime work.
As I said, we're going to do a second bit on this, which just talk about the interactions with the PH centres. But as a general conclusion here, this is I'll go to Martin first on this one as well. What would you be a key message to people with PH and their family and friends and loved ones at this time about, let's say between now and the new year, which is not that long away? I think there's about 95 days to Christmas, whatever Christmas will look like. But what would your key message be to people with all the things that we've talked about?
I guess I would ask them to avoid paying too much attention. I mean, clearly keep abreast of what's happening in the news, but don't get too depressed by what they hear, because there will be a time, and I hope it's not going to be too far away, when they'll look back on what's happened this year and think, well, that was the year of the pandemic, but we're through that now. And I don't think, hopefully, that won't be too far away. So this part of their life will will get back more towards normal. And that, I guess, from backing up what John said earlier, that balance is very important. If they get paralyzed by anxiety about possibilities with this, then that could be as harmful as the virus itself. So they should certainly focus on keeping up their spirits, keeping up their mood, and that a lot of interesting change is coming out of what we're going through this year. Things are changing quite rapidly in how we deliver healthcare in this country, in this condition, and that hopefully we'll be able to go forward from where we've been this year with a much better service for them than we had in the past, because of the changes that we brought in.
John, what would anything extra you'd add to what Martin said, sort of message?
Well, of course, I agree with everything Martin said, and I suppose one other thing I could say is what we've already said, that I think it's vitally important that between us being people with pulmonary hypertension, healthcare professionals, friends, we continue to manage your PH, and that includes being seen when necessary, keeping up with appointments, and looking after your mental health and exercise as well. So I think I would add that.